We know that many acute treatment options exist for migraine. However, literatures comparing the efficacy of those medications are limited to small-scale randomized controlled trials comparing 2 to 3 medications. So there has been limited study comparing multiple medications together at the same time. Therefore, in this study, we conducted a simultaneous comparison of 25 acute migraine medications based on 10 million patient-reported migraine attacks extracted from a smartphone application, which is Migraine Buddy. So in this study, we utilized real-world patient-reported health data, like the data they entered in the headache diary smartphone application. And then we employed this 2-level nested logistic regression model, which is a way to compare a large amount of medication with considering users that are recording multiple migraine attacks, and they might be taking many medications within the same attack. So the methodology that we utilize is a way to help us analyze those complex correlations. After our analysis of this 10 million migraine treatment record, we found that overall triptans is considered the most helpful class of medication, followed by ergots, antiemetic medication, anti-nausea medication, opioids, NSAIDs, acetaminophen, and combination analgesic like medications like Excedrin. Among the triptans, or among the individual medications, we found that Eletriptan is considered to be the most helpful medication, followed by Sumatriptan and Sumatriptan. Note that in our analysis, patients reported that Frovatriptan is considered to be the least helpful among the triptans. However, the odds ratio that the effectiveness is still much higher compared to any medication in other classes. So our results strongly support the use of triptans, which is the first class of migraine-specific medication. Note that in this analysis, we did not include newer migraine-specific medications such as gepants and ditans, and that's something that we will incorporate in future analysis. To the best of our knowledge, this is the first big data analysis that we did head-to-head comparison of 25 acute migraine medications, and then we found that in our study, triptans are considered to be the most helpful, followed by ergots, and then antiemetic medication. And users in generally consider those medications more helpful than other medications, such as opioid, that we don't recommend patients using. So I think the take-home message from this study is that, first, we found users reporting triptans to be very helpful for their migraine attack. And I think we strongly support the use of triptans if patients are able to get that, as most patients report it to be quite effective. And another take-home message from this study is that we are able to utilize this patient-generated health data that were entered into an electronic headache diary and gain derived insights from this big data analysis, that those are the insights that are not easily generalizable from smaller scale randomized control studies.